My name is Daly. I'm a board-certified orthopedic surgeon specializing in sports medicine here at OrthoUnited. I'm originally from Elyria, Ohio, and I started my training at The Ohio State University. During my time there, I was part of the football team and was part of several Big Ten championships. I then went on to stay at Ohio State for medical school for 4 years, and later went on to an orthopedic residency at SUNY Upstate in Syracuse, New York. After that, I chose to specialize in sports medicine, and I went to Wake Forest University, where I was a team doc as part of their football team, basketball team, as well as Winston-Salem State University. I decided to come back to this area in Northeast Ohio, primarily to be close to family. You know, growing up in Elyria, it was close to home. My wife was from Canton, Ohio, and went to school around here, and our family was all within reach. So looking for job opportunities around Northeast Ohio, looking at the hospital systems versus private practice. I interviewed with OrthoUnited and I think just found the perfect fit. When choosing a place to come and live and to join a practice, I think an important factor was Canton, Ohio and the surrounding areas and how great it is to raise a family. And a big part of that is the great school systems here and then being a part of that community. I have young children that are involved in sports, and with that you get to see a lot of your patients out. You get to take care of a lot of the people that you're playing sports with, and you get to be a kind of a part of that world, which is special. It's fun to be out there and see the kids that you've taken care of back out there playing, see their parents and run into them at festivals and at grocery stores. And it's just nice to be a part of a great community here, whether it's Jackson, North Canton, Louisville. You know, you kind of spread your time around and you get to take care of it and really get involved. When trying to choose a specialty, I think it ultimately came back to my background in sports and trying to keep active people active. I really like the variety that I get in sports medicine. All the injuries can be very unique, but then most importantly, it's the patients that I get, and when they have devastating injuries that seem like they are gonna change their lifestyle or maybe ruin their athletic career, when you can bring them back and get them back on the field. Or even for our older patients, when you just allow them to stay active and doing the things that they love and enjoy, there's some satisfaction for me in that as well. But I think the easy answer for what made me choose it is the variety. It's exciting and no injury is the same. One great thing about being a sports medicine doctor is the diversity of the patients that I see, and it can be your young kids playing rec sports to high school and college athletes, all the way up to grandma and grandpa playing pickleball and golf and things of that nature. Everyone's afraid when they come in that if they're injured and they see a surgeon like myself, that surgery is the only option. But at OrthoUnited, we have multiple options. That's never what we want to do. We don't want to do surgery unless it's the right thing for you, if it's what you need to actually fix you, and I can fix you. A lot of times you need to work with a great physical therapist. Sometimes there's medications, sometimes there's therapy. Sometimes you just need to talk to me and get reassurance that your injury is maybe not as bad as you fear. But I think we offer everything here, and I really enjoy seeing people of all ages and lifestyles and trying to keep them moving and as active as they can be. Well, so one of the great things of having all these treatments and diagnostics in-house and having our own surgery centers is the way that we can get you diagnosed and treated in a more timely manner. You know, opposed to the hospitals where things can take weeks to months, we can oftentimes get MRIs in days to a week. If you were to need a surgery at the surgery centers, we can often get you on within weeks. And then once you get there, the experience from what we hear and the feedback we get is very pleasant. The day of your surgery, the experience is usually very efficient. Our staff is well trained to get you taken care of and get you home as quick as possible. Our staff at these centers is specifically trained to orthopedic surgery. You know, it's not like the hospitals where one day they're doing general surgery and other things. They're there every day doing surgeries like you'll be getting and taking care of you in a specialized manner. As athletes come into my office with injuries that oftentimes can be devastating, I feel like I can relate to them because I was an athlete myself once, and I underwent some of these injuries myself. You know, I had surgery on my shoulder, broke my collarbone, I broke my ankle, and I understand how hard it can be to take the time off to heal. I understand the desire to get back, and I understand how important sports are to these patients' life. With that in mind, I think that I have an inside perspective on what it's like to get them back to playing. And I think where a lot of other providers and doctors might tell them, no, you can't do that and you can't do this, My goal is always to try to tell them what they can do and get them back to doing those things as soon as possible and as well as possible. So I am an orthopedic surgeon that specializes in sports medicine, but in my mind I'm still an athlete. And as an athlete, I have the pleasure of treating other athletes. And that's probably the best part of my job, is treating these athletes, going through the experience that I've been through and knowing how important these things are. I just like to work to get them back to doing all the things that they love. And I think the best part of my job is seeing the success stories, is seeing them when they come back for their last follow-up visit, releasing them back to sports, getting them back to their senior year, and getting them back to, hopefully moving on and keep playing farther and farther in their career.